Okay, so now we're going to talk about spermatogenesis. So essentially that's what I was talking about before. But now we're going to talk about how the process of how sperm are developed and what each thing is called. Okay, so sperm production begins at puberty. Okay, the cells that are going to become sperm are called spermatogonia. Okay, and they're 2N, so that means they're 46. What is going to happen is they're going to go through meiosis. So they're going to become primary spermatocytes, and they're still 2N. And that goes through meiosis 1. Then they become secondary spermatocytes, which are N. Okay, so they're haploid. So they only have 23 chromosomes. And then they become spermatids. And spermatids are still haploid, okay, but they're round cells. The very last part is actually called spermiogenesis, and that's when they are the tail is made and they lose their cytoplasm. So that's the very last part. On this picture, you can kind of see the progression. So this would be inside the seminiferous tubule. Here's the Leydig cells, the interstitial cells. The cells are going to develop. So here's a spermatogonia, then a primary spermatocyte, a secondary spermatocyte, and then like early little sperm. Okay, and then you get the full developed, the total sperm. Okay, now the ducts. So I walked you through this once, but let's quickly, I guess. So there are efferent ductules. Efferent ductules are in the lobules. Okay, so 12 small ciliated ducts collecting sperm from the testes. Actually, they're not in the lobules. They're past the lobules. So you have the lobules, and then you're going to go through the testes, and then you go to the efferent ductules. So these are going to be taking it to the epididymis. So they have cilia. So the cilia's job is to sweep the sperm along. Okay, the epididymis is going to be where the sperm are maturing and where they're stored, so they can be fertile for 60 days. Okay, the ductus deferens, okay, is the tube that's going up from the scrotum into the back of the bladder. All the way through this, the sperm are not in liquid. Okay, so the sperm, it's dry. So there's peristalsis moving the sperm, and there's cilia moving the sperm. Okay, now, once you go through the ejaculatory duct, the sperm are going to take the secretions from the seminal vesicle, okay, and it's going to go through the prostate. So this is when they get into liquid. So the seminal vesicle is going to contribute most of the fluid. Okay, and then the sperm are going to go out the urethra. Okay, so here's the picture. So go from here, they're going to go out here. In this way, there's the seminal vesicles. Okay, there's the prostate gland. There's a little ejaculatory duct. Okay, so seminal vesicles are making the semen, the liquid. Okay, and then that's it. Okay, now the accessory glands. Okay, so the way that they're set up is there are 2 seminal vesicles, okay, and they dump into the ejaculatory duct. They secrete this viscous, whitish yellow alkaline fluid. Okay, it has fructose in it to give the sperm energy, and it's got prostaglandins in it. The prostaglandins are going to help with fertilization. So they're going to thin the cervix so that the sperm can get to the eggs. Okay, now the prostate gland, we only have one of those. Okay, it's below the bladder, it surrounds the urethra and the ejaculatory duct. It also secretes a milky fluid. It's weakly acidic, it's got some citric acid in there, it's got this seminal plasmin, which kind of works as an antibiotic, and it has PSA. So PSA is prostate serum albumin. It's used to test for, PSA is used to test for prostate cancer. So if the number goes up too high, it's a sign that your prostate could be getting bigger and could have cancer. Okay, now the bulbourethral glands, they also call these the Cowper glands. We have 2 of those. Okay, and it's the lubricating fluid that's going to clean out the urethra before the semen comes out. That's what the fluid that they make. Okay, now here's just a little chart. It's got the characteristics of semen, what's in it. Okay, so in order to be fertile, it needs to be between 50 and 150 million sperm per milliliter. 60% of them need to be active. Okay. All right, now here's the penis. I think you guys are okay with this because we talked about the anatomy, the two corpora cavernosa, one spongiosum. The root is what attaches the penis to the body. And it hooks to the urogenital diaphragm. Okay, so there's that. Okay, and I'm going to let you guys read through the book about the male sexual response. Okay. And I think that's it. Yep, I'm going to let you read that.